Good evening. My name is Dominique Ferruda. I am a graduate at the Houston Christian University. Currently doing my presentation for Journal 3, Substance Abuse Anonymous. Uh, Course number is 6324. Today I'm going to be speaking on an individual by the name of John. John is a 64-year-old African American male. John's drug of choice is marijuana. Just a little background about John. John is a vet who has retired from the U.S. Navy. Once John told me that his drug of choice was marijuana, I asked him in regards to the prescription from the doctor. The first question I asked was, have you considered consulting with your doctor on that? He said no. John said, I am sure that they probably have a liking of what's going on, but some certain things just to keep to yourself, okay, I don't. I wouldn't trust my doctor on that, nor would I trust government controlling that. I mean, the U.S. military government control being. So currently, 40 states in the the district, 40 states and the District of Columbia have approved medical marijuana programs, as well as for Guam, Puerto Rico, and U.S. Virgin Islands. Um, Two additional states have passed medical cannabis legislation that is expected to be fully implicated on a later date. And this actually helps vets who do suffer from PTSD and other um, disabilities from the war. They're um, they've pretty much decided to um, do more medical cannabis use instead of taking pills. Now, I asked John, when did you first begin using the drug of choice? John first tried marijuana and hash in 1978 when he was in the U.S. Navy. John expressed to me, during that time, the marijuana was more pure, so smoking marijuana was kind of a norm, especially with being in the U.S. Navy. That was just something that they did for recreational use and helping with the anxiety of being in the Navy. I asked John, how much do you typically use in one setting? John expressed how he would smoke 10 blunts a day and that it might be like 1 gram each blunt. He said currently he smokes five little mini blunts or 4 to 5 blunts in a day. He did express to me how he does have an interest in reducing his marijuana use as well. Which situations or emotions typically led you to use? John expressed he is just living in a society and it's like a rat race. He explained to me that he was currently diagnosed with uh, anxiety and depression, and that's why he has chosen to do marijuana to help regulate his symptoms from increasing and helping him stay more calm. How has your substance use affected your physical health? John expressed that It depends on what marijuana he smokes. Typically, he said he gets energized. For John, he doesn't have a negative effect, and he hasn't developed a cough or he said a chronic anything. The next question was I asked John, how has it affected your mental health? John was diagnosed with anxiety and depression. He has been prescribed medication, but he declined to take his medication. John declined taking the pharmaceutical, stating that he doesn't trust any type of government officials. So he has also like a government type of bias with taking medicine, and he prefers more of cannabis use. The next question was, has your substance use impacted your relationships with family or friends? John said that he can't say uh, his use of marijuana has affected his relationship with friends and family because he's been a loner. His family has main his family are mainly in Ohio, and John has recently lost his mother 3 years ago and his father 4 months ago. So I feel like he uses the marijuana as more of an emotional suppressant, and he typically that's his way of coping. When it comes down to spiritual beliefs, John expressed that he would say it didn't have any effect on his spiritual beliefs. Uh, Effect one way or the other, but maybe in his 40s and 30s, when he was looking for a job, he had an effect. He effect that he had to quit because he wanted to get hired, and you had to take a standard drug test. And then during those periods of times, in those, when you had to get a job, you were subject to have random drug tests. So he said that it hasn't changed him more than a spiritual belief. Lastly, these are my references that I've used. I definitely would recommend for John to definitely go to his doctor in the VA so um, he can get a proper prescription for his cannabis use to help with PTSD because it has been clinically proven, to treat patients that live with PTSD that are veterans. Um, the next I would recommend for him would to possibly go to individual therapy just so he can have a safe space to express how you feel, as well as some CBT, some cognitive, because he has a lot of trauma to work on him reframing just his whole thought process because he is a loner. And I think if he had a safe space to actually express how he feels, he would be more, um, he won't be so quick to go into substance use. And thank you so much.